I'm Neil Goldfarb. I'm president and CEO of the Greater Philadelphia Business Coalition on Health. My background is I spent around 35 years as a healthcare researcher. I'm trained as a health economist, and I worked a lot on measuring and improving healthcare quality. And I started to do research looking at the role of employers in driving improvements in quality and value in healthcare. And did some national research that basically said employers are the stakeholder group that's most likely to have a measurable impact on healthcare value in the United States. So I became very intrigued by that notion, and in fact had the opportunity to meet with business coalitions in other parts of the country and saw what they were doing. And I said, we need a business coalition like this in the Greater Philadelphia region, bringing employers together to really hold the healthcare system accountable for delivering on the promise of quality, safety, value, access, affordability, and now equity. So that's what motivated me to start the coalition and keeps me motivated to this day. Our coalition offers a lot of value to employers. I think, first of all, we provide a forum for excellent education with local and national speakers, and we provide a forum where employers can talk to and learn from each other. This was evidenced during the pandemic when we had employer forums where employers just got to talk to each other about how are you managing remote workers and health? How are you managing promoting vaccines? How are you managing worksite policies like masking and return to work? And we were really able to demonstrate our value for employers to talk to and learn from each other and see if they were doing things that aligned with what their peers were doing. But more than that, I think we as a coalition really are able to represent employers' interests in working with healthcare providers and healthcare plans to demand value and to really work collaboratively, but also at times to hold those organizations accountable for delivering on better value. So we're representing employers' interests. There's no other group, no other consultant who is really going out to providers and going out to health plans and saying, what are you doing about transparency? What are you doing about improving outcomes for people with diabetes? How can we employers work together with other agents in the system and the community to improve population health? So I think we play a really pivotal role, and I'm very proud of what we've been able to accomplish. I think that if you look at what we accomplish as a coalition and what coalitions across the nation accomplish, it's something that really delivers additional value to employers that they don't get from benefits consultants, they don't get from health plans. And I would ask employers to think about what they're paying vendors, what they're paying benefits consultants, what they're paying their health plans, and then look at what the value proposition is for a coalition membership. I think that they'll see that what we deliver in return for what they are paying in membership generates a really positive return on investment. Well, we celebrated a major milestone with our 10th anniversary celebration last fall. We started our coalition with 8 employer members and 8 affiliate members, and we now have 53 employer members representing over 1.5 million covered lives. We also have 49 affiliate members. I'd like to think that that growth is a reflection of somebody thinks we're doing something of value. We definitely want to continue to grow. We hope that other employers in our region will recognize how important it is for employers to work together and that we provide a forum where they can do that. And I'd like to think that over the next 10 years, we will be able to measurably demonstrate impact on the health of the workforce, the health of the communities that our workers come from, and the value employers are deriving from their health benefits spend. So I think that it's incumbent on employers to recognize that they are not currently getting good value and that they just keep throwing more and more money at a system that is not delivering efficiency or better outcomes. We have the power, and we need to do more to really drive the discussion and make change happen.